Senator Donnelly.
Thank you. General Odierno, as we have discussed before, and we appreciate all your efforts on this, I view the mental and behavioral fitness of our soldiers also as a readiness issue. I appreciate the Army's leadership on implementing smart behavioral health screening policies. In particular, I want to highlight the leadership the Army has shown on implementing annual enhanced behavioral health assessments for all active duty soldiers, not just those in a deployment cycle, but for all active duty soldiers as part of their periodic health assessments. And I understand the Army is working on implementing the same policy and tools in annual assessments for the reserve component. And I was wondering, General, what the status of that effort is at this time.
Well, first off, a couple things have happened, which is good. First, now the Army National Guard utilizes a director of psychological health to assess all of their programs. That's a new initiative that we put into place, and they support all 54 states and territories when they're doing this. The other thing is we have incorporated telebehavior health, which is really good for the Guard and Reserves because it enables them now to not necessarily have to be right there, but we can do it over a long distance, where we then can utilize some of the Army capabilities when we have behavioral health. But there's still a lot more work to be done. The other piece we've done is TRICARE Reserve Select, which is a low-cost premium-based health plan, which you all approved for the reserve component. And that's enabling them to go outside to get this help. So we now have some things in place that will help us. We're also putting behavioral health specialists at the brigade level in all the components. So a combination of all these things are beginning to help us. We still have a distinct challenge in the reserve component, and that is reaching out to them on a regular daily basis like we can active component soldiers because of the fact that they are spread out along large distances and they have other jobs where they're not in daily contact. But the Guard and Reserve are putting in several different initiatives that help them to reach out. So we're nowhere near where we need to be, but we have made some progress.
And General, this is a little bit different from the original question, but one of the things I've heard is you've worked so hard to eliminate any stigma to seeking help. But I have still heard that some Army members or Reserve members that they'd rather see somebody outside the uniform, I guess would be the way to put it. Has there been any thought in terms of making sure that there is in towns where you have such a big place, or in bases where you have such a huge presence, to having somebody just outside the gates who may not be connected per se to the Army, but is there to provide those kind of services?
Each one of our major installations on the active component are working very closely and have relationships that they have a behavioral health network that is available, and they identify what that network is so people have options. As I said earlier, for the reserve component, it's now TRICARE Select, and that helps them then to obviously seek help outside of the uniformed military to do this.
Thank you. And do you know, General Grass, whether there is an effort to provide the same type of annual behavioral health assessments for the Guard as well?
Senator, yes, there is. And today we have 167 mental health clinicians across the Guard, both with the Army and Air. At the Air level, we are at each wing. In the Army level, we have one in every state, contracted clinicians. We also have 24 additional in our high-risk areas of the state. Thanks to the Congress, we have another $10 million this year that we're applying to bring on additional. What I've been working with the Air Force on is to convert some of those contract positions to permanent civilian positions, and we want to do the same with the Army so that you put someone in the state headquarters or in a unit that's going to be there, and when the contract runs out, you don't lose them, and you bring them from, as you said, sir, from that community that they understand the problems we're dealing with.
And this would be for both of you. Are there any challenges to that drive to provide those services? Obviously, there are financial challenges because of resources. Are there any other challenges on this end we can be helping you with to try to make sure that you have the tools necessary to provide those services?
So I'd say a couple things is we have the tools. So I don't think we need help from you. There's some things we have to do internally.
Okay.
It's hiring more behavioral health specialists. The only other thing I mentioned the other day in the wake of the Fort Hood is it has to do with our getting commander access to information. And there's some internal things we can do, but there might be some legislative things that we have to look at, and that should come out of some of the studies we're doing based on what happened at Fort Hood.
Okay.
Senator, if I could add one thing, and we've had great support from the Army on this, but a lot of our capability and our resources have come through overseas contingency money. And as that money dries up, we're concerned about what we'll have left behind there to execute the mission. Working very closely with Health and Human Services and Veterans Administration, because one of the concerns I have, as you know, over 100,000 men and women coming off to active duty with 4, 5, 6 years in combat. How's that going to have an impact? And we hope to attract them in the Guard, but how is that going to have an impact on them and their mental health? And I don't think we as a nation have tackled that yet.
General Odierno and General Grass, thank you, and thank you to all the men and women who serve our country.
Thank you very much, Senator Donnelly.